Hi, I'm Dr. Edwin Williams. I am a New York-based rhinoplasty specialist with about 23 years of specializing in rhinoplasty. It's something I'm passionate about. One of the questions I'm asked all the time are, what are the risks of rhinoplasty? They are different because in someone who's a teenager, there is one additional risk that adults don't have. So the first thing is really has to come down to the age. I usually say that if we were to do rhinoplasty too soon, before someone has stopped growing, that is not ideal. What we want people to do is be at the end of their growth. So what I usually tell moms and dads and teenagers, 17, 16-year-olds, is that for girls, when they stop changing their shoe size, and that's typically around 15 or 16, for boys typically 16, 17. So that's one particular risk that teenagers have that adults don't. Second thing is, and I don't want to sugarcoat this, but experience matters. I've done several thousand rhinoplasties over the years, and I think that one of the risks of not having a perfect or ideal outcome really comes down to surgeon experience. I will tell you that this is a surgery that I'm passionate about. I find it fascinating, and yet it is the most difficult surgery to do and to do well. So I think it's important to choose someone who really specializes not only in rhinoplasty but revision rhinoplasty, has done it for years, who's taught about it, not just someone who does one upon occasion. I think board certification is very important, but more important is experience. So experience matters to have the best outcome. So really there are a few different risks that we talk to patients. I talk to patients about bleeding. I don't pack the nose, I put a dressing in each nostril, but I can't tell you the last time, and maybe 15, 20 years ago, I had someone that had some bleeding, had to take them back and put some packing in the nose. But that's rare. And the same thing with infection. Infection is rare as well. Upon occasion, you'll see someone who developed an infection after rhinoplasty and you have to change the antibiotics. So that's another kind of a rare risk that we talk to patients about. And the third is anesthesia. People are always afraid of anesthesia. Well, let me put it in perspective. We do our anesthesia in a fully accredited ambulatory surgery center, one whereby half of my staff, my family members, my wife, my mother, my sister have had anesthesia. In 23 years of doing rhinoplasty, I have never had an anesthesia issue with a patient. So it's kind of like flying a commercial plane nowadays. The systems are very safe, but it is something we talk about. And I will tell you that to me is certainly a remote or very minuscule risk. One of the other risks that I talk to patients about are breathing issues. I think if too much is done with rhinoplasty, people take down too much of the bump or maybe inexperience, it is possible to have some problems breathing afterwards. And to me, that's why it is absolutely critical that you seek out someone who has a lot of experience with rhinoplasty, because someone who has, for example, my first board comes from ENT, where we studied the breathing and the function of the nose, and then I went on and did plastics. So we really pay a lot of attention to breathing issues. And then there's the whole poor outcome thing. I think, again, one of the best ways to avoid a poor outcome is to make sure you're working with someone who has a lot of experience with rhinoplasty, and that will assure you the best, the optimal outcome. The approach that we use, because again, the most important thing, not only with teenagers but with adults, is to leave the individual with a very balanced nose that looks natural and fits their face. The approach that we use is the endonasal or closed or scarless, because I think it's a lot less traumatic to the nose and has a much easier recovery period. So I hope that answered some of your questions about the risks of rhinoplasty. If you have any other questions, we have a lot of the frequently asked questions in this book that we wrote, Rhinoplasty, Everything You Need to Know About Fixing and Reshaping Your Nose. It is available as a PDF download from our website. It also can be found on Amazon, and the proceeds of this do go to victims of domestic violence. So thanks for taking the time to watch.